Alright guys, so we're going to talk about chromoblastomycosis, right? Chromoblastomycosis, right? So I couldn't actually even bring the real pictures, you understand? It's really a crazy thing, right? So one thing you can actually use to remembering this chromoblastosis is you see this word blast, just take it up on you that it's like as if a bomb blast occurred to your leg. Alright, that's the way I actually used to understand this. So it's a chronic fungal infection of the skin and subcutaneous tissue caused by traumatic inoculation of some certain pigmented fungi. Right? So what are the different types of fungi that could actually cause chromoblastomycosis? We have the what? Fonsecaea pedrosoi. We have the Cladophialophora what? Carrionii. We have the Phialophora what? Verrucosa. We have the Fonsecaea compacta. So transmission it occurs when fungal spores enter the skin, maybe through like minor traumas and all of that. You get it? So symptoms is initial stage, there could be red papules or nodules at the site of inoculation. Progression, these lesions will now slowly progress, forming what like nodules that coalesce in larger plaques, right? So complications could lead to ulcerations, formation of ulcers. Okay. Formation of ulcers. Okay, formation of ulcers. So yes, there you could also have some secondary bacterial infections. Rare cases can cause what squamous cell carcinoma. Right? These are a histological stain of it will look like. Okay, all right. So diagnosis is clinical examination. So just based on how the skin is appearing, then laboratory tests like skin scraping are examined under a microscope with potassium hydroxide prepared just to identify the fungal elements. Then antifungal medications like oral itraconazole, voriconazole, amphotericin, right? Surgical interventions, okay, that's a treatment, right? A surgical intervention could also be necessary. Prevention is always wear gloves or protective clothing when handling plants or soils, right? Because just from all the small pricks, that's where we actually have all these complications. The prompt cleaning and covering of any skin injuries that usually come up. Okay. So I think that's just it for this one. Bye for now.